Welcome to this predicted paper from Psychology Ninjas. This paper represents the best guess for the upcoming exams. Please use this paper in addition to your other revision. You can complete a unique version of this paper by going to our Psychology Ninjas site. Psychology Ninjas is full of free content to help you with your exams. You can save your scores with a free account. Describe 2 features of a disorder other than schizophrenia. We've got options here, and this one is going to focus on anorexia nervosa. This question is worth 2 marks. Here we have the command word describe, which means we need to give detail in our discussion. There is some psychological knowledge here in terms of this idea of features. Where we're talking about features, that's particular statistical data in relation to the onset or gender differences of that particular disorder. This question is worth 2 marks, and so we need 2 separate features discussed in detail. Let's have a look at a response. Anorexia nervosa has the highest mortality rate of all mental disorders, with females being 6 times more likely to die from this clinical condition. We've identified a feature in terms of the high mortality rate, and we've extended that into a description by giving specific details about the likelihood of this. It's now time to discuss a second feature. Prognosis for anorexia nervosa is significantly improved in terms of survival and recovery when individuals are diagnosed at a younger age and if the length of stay in hospital is longer on their initial hospitalisation. Our other feature is about prognosis, and we've linked this into survival and recovery. We've said when this is more likely in terms of a younger diagnosis and a longer initial stay in hospital. Oscar is conducting a study to investigate the relationship between clinical experience and positive interactions with patients. He collects data on the number of years that different clinicians have been qualified. He also conducts cross-sectional research, asking patients to complete questionnaires about their daily experiences in 10 different inpatient facilities. Explain how Oscar could show an awareness of the Health and Care Professionals Council HCPC guidelines for clinical practitioners, 2 marks. Our command word in this question is explain. This means we need to give extension and detail. By doing this, we need to have examples and showing off our psychological knowledge. Our assumed psychological knowledge in this question is of the HCPC guidelines, that we understand what these guidelines are about. Given that this is a STEM question, we also need to link this into Oscar and his particular circumstances that we have been given. Both of our marks here involve application, and so we need 2 separate links to the STEM for the 2 marks that we have available. Let's have a look at a response. Oscar needs to be honest about his findings and report concerns to the General Medical Council if patient questionnaires reveal concerns or disclosures of abuse about their experiences. We've demonstrated our knowledge of the guidelines by saying that Oscar needs to report any concerns. That isn't enough to get our mark, so from here we need to explain how this affects Oscar's particular study, in that he has collected patient questionnaires and these might reveal any concerns. We're going to tick off questionnaires within our STEM to show a variety of use of the STEM and get all those application marks. So there's 2 marks in this question, so we need another way in which the HCPC guidelines might be relevant. He needs to consider the phrasing of his questions carefully to reduce the risk of escalating behaviour or symptoms of the patients in the facility. Again, we've shown our understanding of the HCPC guidelines in terms of reducing the risks for patients. We've linked this into the STEM by having an understanding of clinical symptoms and behaviours, as well as understanding that these patients are in an inpatient facility. So we can tick that off in our STEM, 2 different pieces of application, 2 parts of the STEM, 2 marks for this response. Table 1. Mean number of positive interactions per day and the number of years the clinicians have been qualified. Less than 2, 5.2, 2 to 5, 8.9, more than 5, 4.5. Draw a bar chart to show the mean results of Oscar's study using the data from Table 1, 3 marks. Here we have the command word draw, which means it's looking for us to actually draw out and sketch out this particular bar chart. The first thing we want to do is draw out our axes. And then we want to put a scale on both axes. Now it doesn't really matter which one we do on which axis for the purpose of psychology, but we're going to make our life a little bit easier and we're going to put our mean number of frequencies up the side. And then we're going to start to plot our points. So we've got 5.2 here. And because we've got a bar chart, we want to leave a space so our bars don't touch. And we're going to put 8.9 about here. And then we're going to put 4.5 in here. And that gets us one of our marks because we've accurately plotted our points. So our next thing to do is label our axis. So this is less than 2. This is between 2 and 5. And this is more than 5. Well, what is this in relation to? Well, this is the number of years of clinician experience. And then we need to label our other axis. So this is the mean. And what is it the mean of? Mean number of positive interactions. And finally, we need to give our whole graph a title. So we're going to say bar chart to show. And we need to put both our IV, and that completes our graph, and also our DV, which completes our graph. Here's one I prepared earlier. Our bars have a gap between them and they are accurately plotted. That's 1 mark. We've got both of our labels operationalised, the number of years for the clinicians being qualified and the mean number of positive interactions per day. We have both our IV, the years of experience of the clinician, and the DV, mean number of positive interactions, in our title. So we get all 3 marks. Oscar is concerned about the reliability of his data and so decides to ask patients to complete the questionnaire at the beginning and the end of each day. The results from Oscar's investigation are shown in Table 1. Complete Table 1 and calculate the Wilcoxon sign ranks test for Oscar's study, 4 marks. So this question is asking us to complete and calculate a particular table. We need to focus here on this being a Wilcoxon sign ranks test, and the instructions for this are in the front of the exam booklet. So we need to complete our table, and the first thing we need to do is complete the difference column. This is requiring us to take this column away from this column. So we were looking at 17 minus 4, and that's going to equal 13. We're going to do this all the way down, ensuring that we have the signs included. Our next step is to ignore any differences that are 0, which means this participant D no longer exists for our study. We then need to order our differences from lowest to highest, and this is when we ignore the signs. So we've got 3, 4, 5, 5 and 13. And then we're going to give these all a rank. Now I like to put underneath their ranks if all of these numbers were different. And if we've got any the same, like we do with our 5s, we're going to take the mean of the ranks. That means both of these become 3.5. And we're going to put this back into our table in terms of our ranks. We're then at the next stage within our statistical test, and we need the sum of the ranks if they are positive differences. So that means we're adding together 5, 3.5, and that's it. So our sum of our rank of our positive differences is 8.5. We then do the same for our negative differences. So we're adding 3.5, 2, and 1, which makes 6.5. We then need to determine which one is our Wilcoxon t-value. Whichever of these 2 sums of the ranks is the lowest becomes our t-value. That's 6.5, so that becomes our calculated value. Oscar used a directional one-tailed hypothesis. The calculated value was 6.5 and the number of participants was 6, with 1 having no difference between the 2 conditions. State whether Oscar's data were significant at p equals 0.05, 1 mark. The command word here is state, so we're giving a specific sentence about our question. We have some assumed psychological knowledge here in terms of significance, whether these results are from chance or not. We need to use the information from Oscar's study in order to make our response relevant. As one of the participants had no difference, we are actually excluding them from our study completely. So rather than having 6 participants, we've actually got 5 participants taking part in our study. There are some other pieces of information from our STEM that we need for our critical values table. That this is a directional or one-tailed hypothesis, and that the level of significance is 0.05. So we've got a one-tailed test or a directional hypothesis, and we're using a level of significance at 5%, so we're going down this column here. And we had 5 participants in our study because we excluded one that had a difference of 0, which means that our critical value is 0. So the first thing we're going to write in our answer is our critical value, and our critical value was 0. And then we need to identify our calculated value within our STEM, which is 6.5. And we're going to compare these two values in our answer. So 6.5 is bigger than 0. This is going to determine whether our results are significant. So the results are not significant. This is because 6.5 is bigger than 0. It will always tell you at the bottom of the table which way round it needs to be significant. Describe the procedure of your chosen contemporary study for your chosen disorder. In this case, we've gone for anorexia nervosa, and this question is worth 2 marks. Our question has the command word describe, which is asking us to give detail and extension. We want as many examples as we can here to show detailed, thorough knowledge. Our assumed psychological knowledge here is about a procedure. This means exactly what the study did or what the researchers did during that particular investigation. We have 2 marks here, so we want 2 separate bits of the procedure. It's really important here we don't have generic ideas that could apply to any particular piece of research. Let's have a look at our response. Participants were matched for age and educational level, with 25 females from an AN eating disorder clinic and 25 healthy female controls. We have detail in here in terms of the participant variables that they were matched on and the number of participants in the study. It's important here that we've also identified that there were eating disorder patients with anorexia nervosa and healthy controls. Let's discuss another part of the procedure from Guardia et al.'s study. An image of a 2-metre door was projected onto a wall, with the width of the door varied from 30 to 80 centimetres. Participants were asked to judge whether they could fit through the door without turning sideways. We've given specific details in terms of the width of the door and how it was varied in this study. We've also talked about the tasks that our participants were asked to do in terms of judging when they could fit through that door without turning. We could go further here or give an alternative in terms of describing perceived passability ratio or perceived critical aperture instead. Explain one strength of your contemporary study for your chosen disorder. 2 marks. This response is going to look at anorexia nervosa. We have the command word explain in this question, which is asking us to give detail and extension within our response. The focus in our question is of a strength of our chosen contemporary study, so we just need one strength. We've got 2 marks in this question, so we get 1 mark for identifying a strength of our contemporary study, and it must be specific to that contemporary study and that disorder. We get our 2nd mark for justifying why that is a strength. Now let's go to our response. There is external reliability as research supports that participants with anorexia nervosa are less affected by size-weight illusions than controls. Judgments that smaller objects are heavier, showing similar results to Guardia et al.'s study. We have identified within our response that there is external reliability, and we've explained that by saying there are similar results to that which Guardia et al. Found. We've then justified this by talking about specific research and that those focused on the size-weight illusions. We've talked about the results of these studies, saying that smaller objects were found to be heavier by anorexia nervosa patients and were more likely to be found by anorexia nervosa patients than controls. Explain one improvement of your contemporary study for your chosen disorder. 2 marks. This response is going to focus on anorexia nervosa and Guardia et al. Study. In this question, we have the command word explain, which means we need to give detail and extension to our response. We need to focus on giving an improvement to the study. Our first mark is going to be given if we give a specific improvement to the study, how we would make this study better. Our second mark is then to justify why that improvement helps this study, generally with a link to generalisability, reliability or validity. The AN group could have had an experimenter who more closely resembled their body size and weight, increasing internal validity, ensuring that differences between the first person perspective and the third person perspective were not due to confounding variables. We've identified an improvement here by changing the experimenter and having the experimenter more closely fit the body size and weight of the anorexic group. We've then explained why this would be a strength. We've identified that this would prove internal validity or accuracy in the study, and we've said why that's important, so that the differences are not due to confounding variables. Evaluate biological treatments for your chosen disorder, 8 marks. This response is going to look at anorexia nervosa as a chosen disorder. This question has the command word evaluate. This is still requiring us to do 2 different skills. The first skill we're looking to do is our AO1, or our explanation. Our explanation is going to focus on biological treatments. In this case, that's going to focus on drug treatments as our biological treatment. The remainder of our marks, our AO3, is going to be providing strengths and weaknesses of biological treatments. We're going to use DESERT in order to help us evaluate. We're going to start our response by explaining a particular drug therapy. SSRIs reduce the uptake of serotonin by temporarily blocking the reuptake transporter to make more serotonin available in the synapse. This means that it is more likely to cross the synapse and extending the appetite-enhancing effects of serotonin through repeated binding with the postsynaptic neuron. We've identified a particular drug therapy through selective serotonin reuptake inhibitors, and within our response, we're absolutely fine to abbreviate that to SSRIs. We've talked about the role of SSRIs and how they work, but more importantly, given that SSRIs are also used to treat depression, we've talked about how this is involved in anorexia in terms of increasing or extending the appetite-enhancing effects of this particular neurotransmitter. We're then going to move into evaluation. Drug treatments are directive, as clinicians use their expert power to have social control over their patients. We've identified that the directive nature of drug treatments might be potentially a problem. We've also linked this into a particular issue and debate by talking about expert power and that being a form of social control. We then want to explain how drugs are directive. Clinicians decide both which drugs the patients with anorexia nervosa take and the dosage that may result in them experiencing negative side effects or reduce the likelihood of a positive prognosis. We've clearly explained how drugs use expert power and are directive, talking about both which drug is taken and the dosage. We've talked about the impact of that on the patient as well to extend our knowledge. In order to provide logical chains of reasoning, we're now going to give a counter-argument. However, drug treatments are not directive as the patient with anorexia nervosa decides whether to comply by taking SSRIs or not. Compliance is a really good argument in terms of drug treatments not being directive. It is always the choice of the individual of whether they stick to the regime that's been laid out for them. We want to complete this paragraph by having a mini conclusion. The use of expert power may result in individuals viewing anorexia nervosa as a medical condition, making it an effective treatment based on the symptoms of anorexia that the patient displays. We've clearly explained how expert power is a strength for drug therapies, talking about the view of this as a medical condition and therefore making the treatment more effective. We're going to move back into explanation now in order to balance our response. Atypical second-generation antipsychotics reduce the availability of dopamine by binding to the postsynaptic receptor sites so that dopamine is unable to bind, reducing the likelihood of the neuron firing. As dopamine remains in the synapse, it is more likely to be broken down by the enzyme beta-hydroxylase or be reuptaken. Second-generation antipsychotics are used to treat anorexia nervosa due to their side effect of weight gain and reducing obsessive thoughts about food, body size and shape. We've identified a different drug treatment here, talking about second-generation antipsychotics. We've explained how they work, but more importantly, we've explained why they're used for anorexia rather than schizophrenia. Their side effect of weight gain makes them ideal for anorexic nervosa patients. We've also talked about their effectiveness in terms of reducing those obsessive thoughts. We're going to move back into our evaluation. Research supports the effectiveness of second-generation antipsychotics when treating anorexia nervosa. We're now going to talk about the effectiveness of second-generation antipsychotics. To explain this, we're going to talk about specific research. Boakye et al. Conducted a case study with second-generation antipsychotics and found significant weight gain and less anxiety at mealtimes with few side effects. We've identified specific research here and explained the findings, which is important given that we're using this as evaluation. Other research could be used here, we've just gone for Boakye et al. In order to develop our logical chains of reasoning, we then want to move into a counter-argument. However, the use of case studies means that there is no control group to compare the effectiveness of placebos or second-generation antipsychotics on non-anorexic nervosa patients, making cause and effect problematic to conclude. We've identified or focused on the use of case studies within this piece of research for our counter-argument, specifically talking about the lack of control group, which means that it's unlikely to be able to establish cause and effect, reducing the validity of our conclusions about effectiveness. We're then going to give a final mini conclusion to complete this evaluation paragraph. The effectiveness of second-generation antipsychotics has mixed results, limiting the external reliability of research findings, and so may not be the most appropriate treatment for anorexia nervosa. By focusing on external reliability in our conclusions, we're saying that there is an inconsistency across different participants from different studies. We've also said the impact of this for treating anorexia nervosa. It's now time to go back to explanation once again. Olanzapine is a dopamine antagonist, but also a weak serotonin agonist. It may influence anorexic nervosa symptoms through blocking D2 or D3 receptors and serotonin receptors. It may also have an impact on the secretion of ghrelin, so that the higher levels are promoted, decreasing the feelings of fullness and encouraging food intake in patients. This time we've explained the role of a specific drug, olanzapine. We've been clear here how this works and the different mode of action of this particular dopamine drug. We've also talked about its impact on ghrelin, introducing the hormone in relation to fullness and hunger. Here we've said the clear impact on patients, encouraging more food intake, important for our anorexic nervosa symptoms. It's time to move back into evaluation once again. The use of drug treatments for anorexia nervosa are not without side effects that would require management by the clinician. The focus for our evaluation this time is side effects, really important, especially when we're talking about drug treatments. We're then going to explain a specific side effect for anorexia nervosa. Anorexic nervosa patients may experience a mild to moderate side effect of a dry mouth or headache. They may also experience serious rare side effects like type 2 diabetes. We've identified a range of symptoms here in order to show off our psychological knowledge and discuss a problem with drug treatments. In order to elaborate in our response, we're going to give a counter-argument once again. It is because of their side effects of weight gain that many drugs have been used to treat anorexia nervosa. Focusing on weight gain as a positive side effect of these particular drugs is the reason why we have used them to treat this particular clinical condition. We're going to complete this paragraph by giving a mini conclusion. Side effects may require additional medication and treatment that may reduce the likelihood of AN patients continuing with biological treatments. We've discussed the impact of this in requiring additional medication for their dry mouth, headache or type 2 diabetes, and the potential impact of this. Because we have the command word evaluate, we're going to give a balanced conclusion to complete our response. Clinicians have a significant amount of power to determine the dosage and type of medication administered, creating a power imbalance. Research has been inconsistent as the effectiveness of second-generation antipsychotics may be dependent on the severity of the symptoms and other participant variables for anorexia nervosa. And finally, drug treatments having the side effect of weight gain have a positive application for anorexia nervosa. Anna is interested in understanding how levels of anxiety vary across different age groups in individuals diagnosed with generalized anxiety disorder, GAD. In order to investigate this, Anna conducts a cross-sectional study by recruiting participants from multiple age brackets. Each participant completes a standardized anxiety assessment to identify whether there are age-related differences in the severity or nature of anxiety symptoms reported by the participants. Discuss how Anna could conduct cross-sectional research to examine the impact of age on generalized anxiety disorder, GAD, 8 marks. In this question, we have the command word discuss, which means we are being asked to do 2 separate skills. Firstly, we're being asked to do AO1, or explain, and that's our first skill in this question. We need to explain the features of cross-sectional research, giving details about what this particular research method entails. The other half of the marks for this question are AO2 marks, or application marks. Here, we are looking at applying this information to our STEM about Anna and generalised anxiety disorder. We're going to start by explaining an aspect of cross-sectional research. Cross-sectional research is looking to take a quick snapshot of behaviour in a given population at a particular time. Cross-sectional research needs to take a large sample in order to get a good cross-section of the target population. We've clearly shown that we understand what cross-sectional research is all about, in that it is a snapshot of behaviour. We've also understood that in order for that to be effective, we need a large sample for our study. We're then going to apply this to our particular scenario. Anna will need to gather a sample of participants from different age groups in order to assess levels of anxiety. She could have different categories with established age ranges in order to gather the sample for testing at a single point in time, such as teens 13 to 17, young adults 18 to 29, middle-aged adults 30 to 59, and older adults 60 plus. Here we've identified how we're linking this into our context. By talking about establishing different age groups in terms of anxiety, we've given clear age ranges for our study in order to show developed understanding of this particular aim. We're going to highlight this in our STEM in terms of talking about age-related differences in order to show a variety of application skills. And then it's time to move on to our next piece of explanation about this research method. Cross-sectional research obtains immediate results, making determinations and comparisons between different subgroups within a target population. Questionnaires are often used in order to compare groups as they impose fewer demands on the participants. Again, we've made a slight comparison here to other research methods within clinical psychology, in that cross-sectional research obtains immediate results, whereas longitudinal research isn't going to achieve that. We've gone further and we've explained how that's possible using questionnaires within this particular research method in order to assess our dependent variable. It's time to return once again to our application skills. Anna could use a questionnaire to establish the severity and nature of symptoms reported by the participants. She could use rank scale questions within her questionnaire, such as on a scale of 1 to 10, with 1 being never and 10 being all the time, do you have trouble relaxing? Anna could also list symptoms of GAD, and participants could select whether this is something that they experience. We've shown our application skills here by giving an example of a particular question. It's really important within this question, especially ranked scales questions, that you say which end of the scale is which. Here we've gone for a particular symptom of generalised anxiety disorder. Now, you wouldn't have to know symptoms for any disorder other than your 2 chosen disorders, so that's schizophrenia and then one other disorder. We've also given a list of symptoms and we've identified generalised anxiety disorder here in order to extend our application. And again, we're going to tick this off in the STEM, highlighting that we've now identified the severity and nature of anxiety symptoms within those questions that we've talked about. It's time to return back to explanation of that research method. Cross-sectional research can be used to measure how common certain outcomes and exposures are. It is often conducted to examine relationships between variables and develop hypotheses about possible causal links that can be tested in further experimental studies. Again, we've extended our knowledge about cross-sectional research, talking about outcomes and exposures and how this is used to examine relationships. A bit like correlations here, this might be used as a preliminary form of evaluation and research in order to then delve deeper using experimental methods. Time to apply once again. Anna could establish whether age is a participant variable that affects GAD, in order to establish trends in the particular symptoms or severity of anxiety within teens or older adults. Anna's conclusions could lead to the development and exploration of age-tailored therapeutic approaches. So we've really focused our application on the particular aim for Anna's research. We've focused in on generalised anxiety disorders and that developing responses to different age groups. By talking about age-related therapies, we're saying that different age groups might need different therapeutic techniques. Maybe some groups are younger or older groups using medication, whereas the reverse is being true for maybe those talking therapies instead. Again, we're going to highlight in our STEM that we've talked in depth about generalised anxiety disorder, so we can tick off a different part of our STEM showing the breadth of our application skills. And now it's time to explain once again a feature of cross-sectional research. Cross-sectional studies aim to describe a variable rather than measuring it. In clinical psychology, they are frequently utilised to examine associations between exposures, potential causal factors, and outcomes such as psychological disorders, by comparing the prevalence of symptoms or diagnoses between exposed and unexposed populations. So we've developed some of those ideas that we talked about in our previous paragraphs, giving a detailed discussion of what we mean by exposures and what we mean by outcomes. It's important here that we're thinking about the prevalence, and we've said that we're describing this variable rather than necessarily measuring it. We're then going to apply this to our STEM for the final time. Here we're going to talk about Anna is looking to establish whether age is a potential causal factor. If it differs significantly in prevalence across age groups, then it's more likely that age is a causal factor. However, if the nature of symptoms and severity of anxiety is consistent across the age groups, then it is unlikely that to be a causal factor. So our application this time has involved giving some potential findings for Anna's research. We're still looking at age as our primary factor and the thing that Anna's aim is about. Here we've said that if it differs significantly across age groups, then age is having an impact on the severity of symptoms and how the symptoms are being displayed. If it's consistent, i.e. all the age groups are showing similar symptoms or similar severities, then age isn't going to be a factor. Skylar has been given a recent diagnosis of schizophrenia following several months of believing that certain TV shows were sending her secret messages. Skylar has since stopped going to several activities that she enjoys and doesn't answer the phone when friends ring. Skylar's maternal grandfather also had schizophrenia, but neither her mother or brother have shown any symptoms. To what extent would a biological explanation other than neurotransmitters explain Skylar's symptoms of schizophrenia? 20 marks. Our question has the command word "to what extent," which requires us to explain, evaluate, and form judgments in order to respond to this command word. We're looking for a biological explanation other than neurotransmitters. we're going to focus on genetics as our explanation for schizophrenia. There are 8 marks for our explanation, so we're looking for 8 marks of AO1. Given that we have a STEM, we're also going to have to do some application skills, linking our explanation back to Schuyler's symptoms. There are 4 marks available for our AO2 skills, so we want 4 separate links back to the STEM. And finally, we have some evaluation skills. For our evaluation, there are a further 8 marks in terms of strengths and weaknesses of genetics as an explanation. To start our response, we're going to look at genetic explanations. Genetic explanations of schizophrenia suggest that genetic variations may be responsible for the irregularities in neurotransmitters. Hilker et al. Found 79% heritability for schizophrenia, demonstrating genes have a significant role in this disorder. By giving an understanding of 79% heritability, we're saying the extent to which schizophrenia is due to genetics. We're then going to apply this to our information about Schuyler. Schuyler has a family history of schizophrenia, with her maternal grandfather also having the disorder, so his genetic variant may have been passed down to Schuyler. We've identified that there is a family history of schizophrenia in terms of the maternal grandfather. We're also going to tick this off in the STEM to ensure that we use a variety of information from the information provided by the exam board. Our next step is to hit those AO3 skills. Research supports the role of genetics in schizophrenia, comparing the concordance rates of monozygotic and dizygotic twins. When looking at genetics, twin studies are going to be important. Here we focused on concordance rates being a part of twin studies, where twin A and twin B are both diagnosed with schizophrenia. Comparing monozygotic and dizygotic twins allows us to establish whether genetics are a causal factor. To explain this, we're going to discuss some specific research. Gottsman and Shields found the concordance rates for schizophrenia were 42% for monozygotic twins compared to 9% for dizygotic twins, with higher correlations for genetically identical twins showing the influence of genetics in the disorder. We've clearly identified research findings comparing concordance between monozygotic and dizygotic twins. We've extended this by explaining why higher rates for monozygotic twins supports genetic explanations. We're then going to counter this in order to establish a logical chain of reasoning. However, twin studies are problematic as similarity may be due to their shared environment and identity confusion rather than genetics. The equal environment assumption reduces the validity of twin studies and, as a consequence, the accuracy of genetic explanations. Our counter-argument shows a strong understanding of problems with twin studies, talking about the equal environment assumption. We've gone a step further here by talking about the impact of this on genetic explanations. Talking about a problem with the method in terms of validity also then means we have a problem with the explanation in terms of validity. To complete our paragraph, we're going to give a little mini judgment here. Genetic explanations are only part of the explanation for Schuyler's behaviour, especially since her mum and brother do not show symptoms of schizophrenia. We've been clear here about the extent to which genetics are causal for Schuyler's behaviour, identifying that her mum and her brother do not have schizophrenia and therefore it can't just be genetics. We're going to tick this off in our STEM in terms of having a variety of information and showing that we're using that STEM in different ways. We're going to return to explanation now. Wright indicates that 700 genetic variants may be linked to schizophrenia, with some genetic mutations occurring spontaneously without a family history of the disorder. Genetic mutations may occur due to environmental influences or an error during cell division. We've extended our discussion about genetic variants here, talking about why genetic mutations might occur. We've got a variety of different reasons here, and therefore showing our extended knowledge about how genetic mutations might occur. The next step is to return to application. As there is no family history prior to Schuyler's maternal grandfather having schizophrenia, it may be that her grandfather was an immigrant, which created a stressor to cause the genetic mutation. We've clearly got application returning to the maternal grandfather, indicating no family history prior to this. We have gone a bit beyond the stem here, giving some inferences about why this mutation might have occurred. You want to be careful here not to go into social explanations or something else, losing focus on the question. It's time to return to evaluation. Genetic explanations are based on correlational methods, limiting their validity. We've recognised here that twin studies and concordance rates are also correlations. We've clearly linked the problem of correlations back to schizophrenia. Talking about if it was just genetic explanations, then MZ twins should have a concordance rate of 100%. They don't, and therefore we've offered some alternatives as to why certain twins might activate their genes and have schizophrenia. We're going to elaborate on this, extending this point further. Furthermore, Tainari et al. Found that although a biological parent with schizophrenia did mean that more adoptees were diagnosed with schizophrenia than controls, 9% compared to 1%, diagnosis only occurred when the adopted family were classified as severely disturbed. We've used our adoption study effectively here. Our first conclusion, or finding from this study, that 9% of parents who had schizophrenia, the adopted children also had schizophrenia, supports this genetic and biological explanation. However, it's really critical that this only occurred when the adopted family were severely disturbed. This supports nurture over nature. To complete our paragraph, we're going to make a judgment once again, reflecting our command word. Adoption studies support an interactionist approach that genetic explanations are only a component of schizophrenia. We're showing our wider psychological knowledge here, introducing the term interactionism, that it's a combination of biological and social factors that would explain clinical conditions. We're going to return now back to explanations. DiGeorge syndrome is caused by a deletion of 30 to 40 neighbouring genes on chromosome 22. 25% of people with DiGeorge syndrome develop schizophrenia, showing this to be a significant risk factor for the disorder. Our explanation clearly highlights the role of DiGeorge syndrome, discussing it in detail and giving an impact. It's important here we talk about risk factors, given that it's not a causal relationship between DiGeorge syndrome and schizophrenia. We're going to return to application once again. DiGeorge syndrome creates a risk factor, explaining why only her grandfather and Skylar have been diagnosed as schizophrenic. Again, we've got a clear link to the stem here, talking about the maternal grandfather of Skylar and her having schizophrenia. Now it's time to evaluate. Social causation hypothesis would explain stressors that mean that DiGeorge syndrome results in schizophrenia. We're looking at a different theory here other than genetics. We've gone for social causation hypothesis as one of our social explanations for schizophrenia. We're going to explain an element of social causation hypothesis in order to extend this evaluation. Vassos et al. Found that an urban environment increased the risk of schizophrenia by 2.27 times compared to most rural environments. We've clearly identified research here and given specific findings in order to show depth and breadth in our psychological knowledge. And now it's time to extend our discussion. Genetic explanations are biologically reductionist as they only focus on physical differences between schizophrenics and non-schizophrenics. We've clearly used the term biologically reductionist here effectively, showing a broader understanding of the impact of just focusing on genetic explanations. Time to come to a judgment once again. Acknowledging the role of nature and nurture in schizophrenia gives a more holistic explanation. By discussing the role of risk factors, we're alluding to this holistic or biopsychosocial explanation that's going to be the most thorough and most effective in tackling schizophrenia. It's time to return to explanation once again. A deletion of the COMT gene may also result in schizophrenia, as it provides instructions for the enzyme that breaks down dopamine in the prefrontal cortex. Schizophrenics show hyperdopaminergia and poor regulation of dopamine that results in positive symptoms. We've identified another genetic variant in terms of COMT and talked about its impact in terms of schizophrenia, that it has an impact on dopamine and we see high levels of dopamine for individuals with positive symptoms or hyperdopaminergia. It's time to return back to our STEM. Skylar is showing positive symptoms as she's experiencing delusions, as she believes that certain TV shows are sending her secret messages. We've identified that Skylar is showing positive symptoms, and we've identified that her delusions are about those TV shows. We've gone back up to our STEM to tick this off. So where she's got certain TV shows sending her secret messages, this might be part of a delusion, and delusions are positive symptoms. We're now looking to evaluate. Identifying candidate genes such as COMT enables individuals to understand their risks through genetic counselling. Genetic counselling is a clear application of our understanding about genetics. Again, we're understanding risks rather than talking about causal relationships. We're going to explain what this would involve. A reoccurrence risk can be calculated to help reduce fears about the inevitability of schizophrenia and help people make rational choices. We've talked about the positive applications of genetic counselling and what could be identified for individuals. In order to complete this paragraph, we're going to have a look at a counter-argument. Those in power could use informational power to control the information about genetic risks so that those with schizophrenia are discouraged from having children due to the risks of their children also having the disorder. We've made a clear link here to social control and about the provision of information about genetics and genetic risks. Controlling the flow of this information is going to be critical for those making decisions about schizophrenia and giving them an opportunity to make informed choices. It's time to form a judgment to reflect that command word. An understanding of genetic factors has had positive implications for society, as informed decisions about risk factors and preventative choices can be made. We've clearly identified the positive contribution and applications of our understanding of genetics to society. Time to return to explanation once again. Individuals with a DIS1 variant are 1.4 times more likely to develop schizophrenia, as it codes for the creation of GABA, which regulates glutamate and dopamine in the limbic system. We've identified another genetic variant involved in schizophrenia, in terms of DIS1. We've also explained how that has an impact on schizophrenia. It's time to apply this information to our STEM. A dysregulation of dopamine due to DIS1 may explain Skylar's negative symptoms, as she has stopped going to several activities that she enjoys and doesn't answer the phone when friends ring. We've identified negative symptoms within the STEM, showing a wide variety of application. We've gone back up to the STEM once again to tick this off to show our wide variety of application. Let's evaluate once again. Research supports the role of DIS1 in explaining schizophrenia. Here we're talking about empirical support, making this more scientific as an explanation. We're going to give specific research support to explain this. Dayon et al. Conducted a meta-review of 14 studies, finding that DIS1 is associated with presynaptic dopamine dysregulation, showing external reliability of genetic explanations. We've identified research here and talked about specific findings in order to show our knowledge. By talking about external reliability, we're talking about the consistency of this across those studies within the review. It's time to extend our argument once again to show off our logical chains of reasoning. The role of different genetic variants shows that psychological knowledge of schizophrenia has developed over time, with the role of additional variants continuing to be explored since the completion of the Genome Project. We've focused on development over time as part of our issues and debates. The role of the Genome Project has been key in identifying different genetic variants. It's time to form a judgment now. The cumulative body of knowledge on the role of epigenetics demonstrates the impact psychological knowledge can have on our understanding of clinical conditions. Where we're using the word cumulative, we're talking about a body of knowledge that has built up over time, showing that this is more scientific and we've built on our previous understanding. It's time to form some final judgments in order to respond to our command word, giving a balanced conclusion. There is external reliability with a range of evidence from twin studies and correlations that supports the role of genetic explanations. Reliance on correlational methods makes it difficult to establish whether genetic variants are the cause or consequence of schizophrenia. The role of social factors demonstrates the need to consider a diathesis stress model to explain schizophrenia. The role of genetic counselling demonstrates the positive impact that psychological knowledge can have. And finally, genetic explanations show how psychological knowledge has developed over time, and the polygenic nature of schizophrenia has been demonstrated since the Genome Project. Isle has a history of minor criminal offences, but has been recently arrested for assault. Isle has a troubled past that includes growing up in a violent neighbourhood, exposure to domestic violence, and struggling with anger issues from a young age. Despite several attempts at rehabilitation, they have continued to be picked up by the police due to an inability to control their temper. Describe how biological explanations might explain Isle's offending behaviour, 3 marks. Here we have the command word describe, which means we need to give a detailed, extended explanation in order to access our marks. Our response needs to focus on biological explanations, but that could be any physical difference between people that might explain criminal behaviour. This is a STEM question, and so we have our information about Isle. This means that all of our 3 marks here are all application marks. So we need 3 different links to the STEM for our explanation. We could have 3 different links from 3 different biological explanations, or the same biological explanation linked to 3 different aspects of the STEM. We're going to look at 3 different biological explanations. Exposure to domestic violence in the past may have increased the size of Isle's amygdala, and so they see situations as threatening and so respond with aggression and violence. Our biological explanation is the size of Isle's amygdala. We've linked this into the STEM by talking about the exposure to domestic violence in their past. We're going to tick this off in our STEM to ensure that we're using different parts and showing depth and breadth in our application skills. We're then going to talk about another biological explanation. Isle may have an underactive prefrontal cortex, making them more impulsive in their behaviour and unable to control their temper. We've identified a biological explanation in terms of the underactive prefrontal cortex, and then we've applied this to our scenario by talking about that they are unable to control their temper. We're going to tick this off in our STEM in order to show again that we've used different parts of our STEM for our different marks. And we've got 3 marks available, so we're going to go for a third explanation. They may have an overactive nervous system and be characterised as having a neurotic personality and have been arrested for assault as a result of feeling the need to protect themselves. We've connected an overactive nervous system to neuroticism from Isaac's personality. We've then linked this into the STEM by talking about the fact that Isles has been arrested for assault and they might feel the need to protect themselves. And finally, we're going to tick that off in our STEM as well, that they've been arrested for assault. We could use other biological explanations here, so as long as we're linking these into different parts of the STEM, they are all valid and would be credit-worthy. Describe how grounded theory would explain Isle's criminal behaviour, 2 marks. In this question, we have the command word describe, which means we need to give a detailed, extended explanation here. There is some assumed psychological knowledge in this question that we understand what is meant by grounded theory, and we understand that this links into qualitative data. Finally, we have a STEM attached to this question, and so all of our understanding of grounded theory needs to be linked into Isle, and this is an AO2 question. So both of our marks here are AO2, which means we need 2 separate links between grounded theory and our scenario. Here's our response. Qualitative data would be gathered through an interview with Isle about their criminal offences, and through qualitative data analysis, a theory about their minor criminal offences would be developed. So we've shown our understanding of grounded theory by talking about that this is generated through qualitative data analysis, and a way that they could do that is through an interview. We've then linked this into our STEM by talking about the minor criminal offences that Isle has committed. And we're going to tick this off in our STEM to show that we have applied this part of our STEM already. As this question is worth 2 marks, we're then going to give a second idea about grounded theory. Theoretical explanations would emerge to explain why Isle has an inability to control their temper that takes into account their troubled past. So we've shown our knowledge of grounded theory in talking about that our explanations emerge from the data and they only explain the data that we have collected. Again, we've talked about how this links into our particular STEM, talking about controlling Isle's temper and their troubled past. So we're going to tick this off in our STEM. A troubled past, okay, and controlling their temper. So we've shown here clearly that we've got 2 different applications for the 2 different parts of our STEM. Compare the use of case studies with laboratory experiments when examining factors affecting eyewitness testimony. 2 marks. Our command word here is compare, which means we need a similarity and a difference. So we get 1 mark for our similarity and 1 mark for our difference. There is some assumed psychological knowledge here that we understand the difference between case studies and laboratory experiments and the features of these research methods. We're looking for a similarity and a difference between them. We need to also focus on this assessing eyewitness testimony. So we want a link or a relevant statement in relation to those, so it's not viewed as generic. Let's dive into our answer. Both research methods have used quantitative methods to understand factors affecting eyewitness testimony, with the frequency of accurate reports and a mean estimation of speed. So our similarity here is the use of quantitative data, and we've given examples of how this has been assessed. The frequency of accurate reports in our case studies, for example, Wilcoxon, and a mean estimation of speed from Loftus and Palmer's laboratory experiment. We're now going to move into our difference. Case studies have found that misleading information doesn't affect eyewitness testimony, as witnesses of bank robberies recalled accurate information, whereas Loftus and Palmer found that the highest estimations of speed were in the smashed condition. So here we've talked about a difference being found in the impact of misleading information. Again, we've given some findings. We've referenced witnesses to bank robberies for Wilcoxon, and again, we could give specific findings for that. And then we've gone for our highest estimate of speed, showing a different outcome for Loftus and Palmer's research. Again, you could give specific numerical data here if you wanted to. Identify one aim from the classic study from Loftus and Palmer, 1974, 1 mark. Here we've got the command word identify, which means we need a specific statement in relation to our question. This question includes some assumed understanding about scientific language in terms of the aim. This needs to be the research question or something that they're looking to investigate within a particular piece of research. And this needs to be from Loftus and Palmer's study. Now it could be experiment 1 or experiment 2, both looking at misleading information. One aim that we could talk about for Loftus and Palmer's study is that memory can be fallible and influenced by post-event information. We've got a clear understanding of this being from Loftus and Palmer's study, in that memory can be false or problematic, fallible, and also that this is about post-event information, anything given after an event, after they've seen or witnessed something. Explain one strength of Loftus and Palmer's 1974 classic study, 2 marks. Our command word here is explain, so we need to give a detailed and extended response. Here we're focused in on a strength, and we're linking this to Loftus and Palmer as our classic study for criminal psychology. This question requires us to identify a strength in this particular study, and then we need to justify that, and that's our AO3 mark. By justify, what we mean is why is that particular thing a strength? Let's break down a response. There is external reliability, as Experiment 1 and Experiment 2 had similar conclusions that misleading information affects eyewitness testimony, as Smashed had the highest estimate of speed and the most reports of broken glass. We've identified a particular strength of this study by talking about external reliability, consistency of findings with different participants. And we've made sure that that is linked into Loftus and Palmer's particular study by identifying that there are 2 experiments, but also that this was about misleading information. We've then justified that strength, saying that it has external reliability, by giving specific findings focused in on that verb smashed, with a higher estimate of speed and the most reports of broken glass. Again, we could go a step further here and give specific findings for this to show off our psychological knowledge. Explain one weakness of Loftus and Palmer's 1974 classic study, 2 marks. Here we have the command word explain, which means we need to give a detailed and extended response. Our explanation is focused in on a weakness, and this needs to link specifically to Loftus and Palmer's study. We get 1 mark of our 2 marks by identifying a specific weakness of Loftus and Palmer's research, and it does have to be enough detail in that we know it's about Loftus and Palmer. We then get a 2nd mark for justifying that weakness. Why is that thing a weakness when looking at the aim of Loftus and Palmer's research? Here's our answer. Conclusions about eyewitness testimony lack external reliability, as Ewell and Cutshall's case study found accurate recall initially and 4 months later, despite the inclusion of misleading questions, suggesting that anxiety may be a more significant factor in accurate eyewitness testimony. We've identified a lack of external reliability, inconsistency of results across different studies and with different participants. We've extended that, and we would need to say different pieces of research that demonstrate this external reliability, that we haven't just randomly put it down. So we've identified Ewell and Cutshall's research, and we'd also, part of that identification, need to give some findings from Ewell and Cutshall's research. Our justification then of why this is a problem that we've got external reliability is that we're suggesting that other factors may be more significant in explaining accuracies or inaccuracies in eyewitness testimony. Corey has a troubled history marked by a series of violent incidences. Growing up in a neighbourhood plagued by gang violence, Corey was exposed to criminal activity from a young age. He fell into the wrong crowd during his teenage years and has been in and out of the criminal justice system for various offences, including assault and armed robbery. Corey gets a rush when he commits crime and craves the excitement that comes with getting caught. Discuss how individual differences might explain Corey's offending behaviour, 8 marks. Here we have the command word discuss. This is asking us to do 2 separate skills within our 8 marks. Firstly, we get 4 marks for our explanation. This is our explanation of individual differences, things that might be different between different people. Sometimes this is also referred to as participant variables. As this is a STEM question, our remaining marks are all about application, how we've linked those individual differences into the STEM, and specifically Corey's offending behaviour. So we're going to start by explaining a particular individual difference. Individual differences in behaviour may be the result of personality differences in the development of an individual's nervous system and their responses to external stimuli. Extroverts have an underactive nervous system, which causes them to crave excitement and requires higher levels of arousal. We've identified personality as an individual difference, giving explicit discussion of Eysenck's personality types, talking in depth about extroverts and how this links into the nervous system. From here, we're going to apply this to the information we've been given. As Corey craves excitement and gets a rush from committing violent crime, this shows that he has an underactive nervous system that needs more external stimuli. This sensation-seeking behaviour may be linked to testosterone levels, making Corey more vulnerable to criminality. So we've linked this back into the STEM and that he gets a rush from committing his crime. We've also identified that actually testosterone levels may increase this level of excitement and extroversion in Corey. We're going to identify that we have used this within our STEM in order to make sure we're using a variety of application skills. We're now going to extend our discussion of individual differences. Personality is based on individual differences in terms of the socialisation process in childhood, which will determine whether the biological basis an individual has in terms of their nervous system results in someone being law-abiding or not. Extroverts are less receptive to operant conditioning and are less affected by punishment for criminal activities. We've extended our discussion of talking about personality as an individual difference by looking at the differences within the socialisation process and that this has an impact on whether someone is law-abiding or not. We've gone into a bit more depth about how this links into extroverts as well. So it's time to apply our knowledge once again. Corey has grown up in a violent neighbourhood, meaning that he's been encouraged to engage in criminal behaviour from a young age. Having been in and out of the criminal justice system, Corey is not receptive to punishment that is typical of extroverts. So we've talked about socialisation here, particularly that Corey has been in and out of the criminal justice system, with lots of different offending behaviour, showing that he's not receptive to punishment and is likely to be extrovert. We're going to highlight this aspect of the STEM, that he's been in and out of the criminal justice system, to show that we're using different parts, boosting our application skills. Let's return to our explanation once again. The self-fulfilling prophecy suggests that labels that are given to people for their behaviour only occur if an individual has internalised or accepts the label that they have been given. Self-fulfilling prophecy is all about accepting a label or internalising it. This is what distinguishes it from labelling theory more broadly. From here, we're going to apply this understanding of self-fulfilling prophecy. Corey has been exposed to violent and criminal behaviour due to growing up in a neighbourhood plagued with gang violence. Corey has internalised the label of being a criminal, and so his criminal behaviour keeps escalating. So here we've talked about a different part of our STEM and where he's growing up and the nature of the neighbourhood being plagued by gang violence. We've returned back up to our STEM to tick this off in order to show our varied and breadth of application. We're going to return once again to explanation of different individual differences. Role models have a significant influence on criminal behaviour, with young offenders being particularly influenced by role models. An individual difference is who you have as a role model and the behaviours that they display. If criminal behaviour is vicariously reinforced and seen to be rewarded, then it is likely to be imitated. By emphasising it's who you have as a role model, we show how social learning theory and role models is an individual difference rather than a social explanation more broadly. And for a final time, we're going to link this to the information we know about Corey. Corey's role models may have been gang members that he has seen being rewarded by power and status, particularly as a teenager, where his peers are more likely to have a significant impact on his behaviour. So we've identified particular role models that Corey might have and a particular time in which these might be influential. And we've returned back up to our STEM once again, and we're going to highlight this, that he fell into the wrong crowd during his teenage years, but also that this is likely to be or potentially be gang violence based on where he's grown up. In our STEM here at the top, we can see our 4 different colours for our 4 pieces of application, and that these are using different aspects of the STEM to give a cohesive and breadth of application skills. Farah was charged with embezzlement and fraud. She was accused of stealing $200,000 from the company where she worked for the past 5 years. Farah, who had no prior criminal record, maintained her innocence, claiming that the discrepancies in the accounts were due to clerical errors and not intentional theft. Farah's barrister has instructed her to wear some makeup and have her hair done each day for court, but to limit her interactions with the court because of her Birmingham accent. Assess how factors affecting jury decision-making might impact Farah's trial, 16 marks. With the command word assess, we need to ensure that we give judgments throughout our response. For our 16 marks, we're going to start with our explanation, and we have 6 marks of explanation. Our explanation is focusing on factors affecting jury decision making. Because we have our STEM, we also need to link this back into information about FARA. There are 4 marks for our application skills. Our final 6 marks are coming from our evaluation of our different factors, our strengths and weaknesses, and how we present these different factors. We're going to start by explaining one of our factors affecting jury decision making. Race is a factor in jury decision making due to in-group bias, where jurors of the same ethnicity as the defendant are more likely to vote not guilty. Jurors see themselves in those who are the same ethnicity and therefore would need a higher burden of proof to convict. We've clearly identified race or ethnicity as a factor in jury decision making, and we've gone a step further explaining how this links to in-group bias. We've also been really clear about the impact or outcome of this. So if they're the same ethnicity, more likely to vote not guilty, and why that is in terms of a higher burden of proof being needed. We're going to move on to application. If FARA has a jury that is not the same ethnicity, then an outgroup bias is likely to occur, especially if she's a black defendant with a white jury. We've identified a different relationship in terms of FARA for our application, talking about outgroup bias this time, and if she's likely to be a black defendant with a white jury, she's more likely to be found guilty. Returning to our STEM here, we don't have any information about FARA's ethnicity, and so we need to be careful not to go beyond the STEM and give FARA a whole backstory that we haven't been given. We have made a reasonable expectation here in terms of just giving a different point of view in terms of outgroup bias. It's now time to move on to evaluation and our AO3 skills. There is supporting research for the role of race on jury decision making. We've clearly identified a strength here and talked about supporting research. We could use empiricism as well as a different alternative term. And then we're going to explain our research. Bradbury and Williams analysed data from real criminal trials in the US, finding that predominantly white juries were more likely to convict black defendants. The impact was more significant for specific crimes such as drug offences. When we're doing our explanation, we need to go beyond just identifying pieces of research to show that we understand the nature of it. We've talked about specific findings here, talking about predominantly white juries being more likely to convict black defendants, and we've shown detail in that we understood that these were more significant results when it came to drug offences. Be really careful, especially if you've selected Bradbury and Williams for your contemporary study for criminal psychology. We don't want a big description here, we need to focus on findings because we're using this for evaluation. We're then going to give a counter-argument. However, just recording conviction rates lacks external validity, as when defendants face multiple charges in the same trials, defendants have been found guilty of some charges but innocent of others. We've identified that recording conviction rates is problematic for this piece of research, but also other pieces of research examining factors affecting jury decision making. We've said that this lacks external validity and that it cannot be applied to real life, and we've explained why that is a problem and justified this weakness. And now it's time to link this back into our STEM. As FARA is charged with embezzlement and fraud, the makeup of the jury may have a less significant impact than Bradbury and Williams' research suggests. So we've linked this back into the STEM, identifying the nature of FARA's charges. We've then said the impact of our understanding of Bradbury and Williams and how this is less significant in this particular instance. We've gone back up to our STEM to tick this part of our application off to ensure we're using different parts of the STEM for different parts of our application. It's now time to move on to a different factor affecting jury decision making. The attractiveness leniency hypothesis suggests that an attractive defendant are more likely to have a not guilty verdict. This is due to the halo effect, where they are presumed to be good people because they are good looking. Attractiveness is another factor affecting jury decision making, and we've talked about the attractiveness leniency hypothesis that more attractive people are treated more leniently. We've also linked this into our wider knowledge from social psychology about the halo effect. It's time to apply now. FARA's barrister has suggested that she wear makeup and have her hair done to look more attractive so that the halo effect will occur for the jury. We've clearly identified aspects of the STEM here in terms of her wearing makeup and having her hair done. We've linked this back into our factor, saying this would make her more attractive. We've returned to our STEM here in order to tick this off, to ensure we're using different aspects for our different factors. It's now time to evaluate attractiveness as a factor. The attractiveness leniency hypothesis lacks external reliability. This means that there is a lack of consistent results across different participants. We're now going to discuss research evidence. Patry found that mock juries that discussed the case were more likely to find an attractive defendant guilty, opposing the attractiveness leniency hypothesis. We've both identified our research here and talked about specific findings. Given that we've identified external reliability being a problem, we would need to discuss more than one piece of research. However, Abavenda and Howe found that female participants were more lenient towards an attractive female defendant and less lenient towards an unattractive female defendant, though male participants displayed the opposite tendency. Abavenda and Howe's research supports the attractiveness leniency hypothesis, particularly with the female participants. However, our male participants did not agree with the attractiveness leniency hypothesis. It's time to come to a judgment about attractiveness in order to respond to our command word, assess. The suggestions by Farah's barrister may only have an impact on a predominantly female jury, and therefore may only have a limited impact on the jury's decision. We've been clear in our judgment here, talking about its limited impact of attractiveness as a factor. It's time to move on to a different factor. Regional accents are likely to have juries give a guilty verdict due to stereotypes and schemas surrounding their behaviour. Although we've identified accents as a factor, we've also explained why this might be causing juries to return a guilty verdict, talking about stereotypes linked into schemas from cognitive psychology, which has a change in our behaviour as a jury member. It's then time to go back to our application skills. As Farah has a Birmingham accent, she is more likely to have a guilty verdict recorded, and so her barrister has got her to limit the amount of time she speaks. We're going to highlight the Birmingham accent because that's given to us in our STEM. We're also going to highlight as application that the barrister's actions in relation to this regional accent. We've returned once again to our STEM, and we're going to highlight that the Birmingham accent has now been discussed as application. We're going to return to evaluation skills now. There is research to support that regional accents have an impact on jury decision making. Again, we've identified research as part of our credibility for this particular factor. It's time to back up this statement with some specific research evidence. Here we're going to talk about Dixon et al. Found significantly higher ratings of guilt in relation to a Birmingham accent rather than a standard British accent. Our specific findings here show that we understand the nature of this particular piece of research. In order to develop logical chains of reasoning, we then want to give a counter-argument. On the other hand, Dixon used a conversation between a suspect and a policeman. Therefore, participants did not have the same level of consequentiality or burden of proof that might be seen in a real trial. It's important here where we're talking about a problem with the research method in that it is a conversation used between the two confederates within the study. It's important that we then say the impact of this on real jury decision making. Here we've talked about that this means that we wouldn't have the same level of proof or burden of proof in this particular instance, and so participants might be more likely to say that someone's guilty when they might be unsure. If they were unsure in a trial, they would be returning a not guilty verdict. Let's return to give a judgment once again, this time on accent. The impact of her Birmingham accent would depend on where the trial was held, but given that the barrister is limiting her speaking, it is likely that the jury is not from Birmingham. Here our judgment is dependent on where the trial is being taken place, and it's absolutely fine to kind of sit on the fence and give both sides of an argument in our particular judgments. However, we've gone a little bit further here and we've used our STEM to say that actually it's likely that this is not taking place, or the trial is not taking place in Birmingham, because they're being limited in how much interaction she has with the jury. Back to explanation now, and to talk about a fourth factor. Gender may also play a role, as female jurors are more likely to convict than male jurors, regardless of the gender of the defendant or whether it is a mock or real trial. We've identified gender as a factor here, talking about female juries being more likely to convict and the circumstances in which they're more likely to convict. It's time for some application once again. Farah would want a jury to have more males in order to increase the likelihood that she is not found guilty. We've made a determination of the impact of this on Farah specifically, saying that she would want a jury to have more males. However, we want to be cautious about this because there's no reference of the jury makeup in our STEM. Let's evaluate gender as our final factor. There are a significant range of other factors that might influence the jury, including personal experience of the offence, whether there is a charismatic leader having a minority influence on the jury, or personality traits of the jurors. A range of other factors have been identified as different things to consider within jury decision making, suggesting that our discussion of the factors that we've talked about so far is not an exhaustive list. We're going to explore this a little bit further. Ash found that minority influence was significant when a Confederate incorrectly said out loud a response in a visual perception test matching lines. We've discussed one of these factors in more detail using research. We focused in on Ash's research, giving specific findings here and linking this into minority influence as our particular other factor. We're going to extend our discussion to give a logical chain of reasoning by using application of all of this information on juries. Furthermore, research into factors affecting jury decision making means that jurors are reminded to be impartial. And when jurors were given instructions that they had to find a defendant guilty beyond a reasonable doubt, racial bias disappeared. We've shown our wider knowledge here and the impact of our understanding, that jurors are reminded to be impartial, and when they are, racial bias disappears. To reflect the command word assess, we want to come to another judgment. It is important that Farah's barrister has the judge remind the jury of their duties and has jurors removed that may not be impartial based on their personal experiences. We've linked this into the STEM by talking about what the barrister should do. We're going to complete our response by coming to some final judgments to reflect that command word. There is empiricism to support the role of different factors affecting jury decision making. The use of mock trials to examine jury decision making is problematic and therefore conclusions lack credibility. Gender, personal experiences of the jury and personality of a single jury member may also affect jury decision making, so juries have to be looked at holistically. There is significant applications to criminal trials showing the importance of the instructions given to a jury. You can complete a unique version of this paper by going to our Psychology Ninjas site. Psychology Ninjas is full of free content to help you with your exams. You can save your scores with a free account.